Hello, my name is Nicola Barker. I am a cardiac TIA nurse for the Primary Care Cardiac Service. Today, we'll be looking at medicines for cardiovascular conditions. An overview of what we'll be talking about today. Why do I have to take all these tablets? Common cardiovascular medications. Importance of taking your medications as prescribed. Safe storage and use. Avoiding waste. Where to seek support and advice, and a bit more details on other medications. So why do I have to take all these tablets? Your specialist and GP will follow NICE guidance, which is based on strong evidence from thousands of good quality trials. NICE guidance gives clear advice on which type of tablets should be prescribed for different conditions and dosages. National statistics show a reduction in deaths and disability following heart attack, TIA and stroke, largely thanks to the development of effective medications. Some are for the treatment of symptoms and others are protective. For example, reduce the risk of further health problems or prevent deterioration. They are usually prescribed by the specialist cardiologist or neurologist for the TIA, and your GP will follow their advice. If you are no longer under a specialist care, the GP is responsible for your medication. Side effects when starting new medication can be an issue for some. For this reason, some medications are increased gradually up to the maximum recommended dose. This is called titration. You must always report side effects and symptoms to your doctor or heart nurse as soon as possible, so the dose can be changed or an alternative offered. Commonly used medications. We have aspirin, which is an antiplatelet. You may also have an additional antiplatelet, clopidogrel or prasugrel. Blood pressure medications, which are abbreviated to ACE, ARB or CCB. ACE stands for angiotensin converting enzyme, and this could be, for example, ramipril or lisinopril tablets. ARB is angiotensin agonist, which for example could be losartan or candesartan, or you may have a CCB, which is a calcium channel blocker. These tend to be for those over the age of 55, those of Afro-Caribbean ethnicity, or those that are unable to tolerate an ACE. For example, amlodipine, diltiazem. Other common medications. Anticoagulants, for example, warfarin or apixaban, rivaroxaban. Stomach protectors, for example, lansoprazole or omeprazole. Diuretics, furosemide or bumetanide. And then there are medicines that control irregular heartbeat, for example, ivabradine or digoxin. So before we go into each medication in depth, we need to look at what issues there may be around taking tablets, such as, for example, how to take medicines safely, how to avoid waste, and where to go for help and tips on good practice when it comes to taking medications. After this, we can look at the medications in more detail if necessary. So, take your medicines as prescribed. So taking your medications consistently is important. Take them on time with regular spacing between doses. Note if they need to be taken with food or on an empty stomach. This can affect absorption or likelihood of side effects. If you wish to stop or change your medication, speak with your GP first. Ensure that you order repeat medicines in good time so you don't run out. Don't wait until you're at your last few tablets. So, like we said, if you have a long-term health condition and suddenly stop taking your medications or change the dose, you may become unwell and there is a risk that you could end up in hospital. So take your medications as prescribed. Most pharmacists try to help if you do run out. Take a list of your tablets when you go away in case you need to order more. Pack enough medications in your hand luggage when flying. Ensure your chemist knows about any changes to your repeat prescriptions in good time. So the next slide is medicines safe storage. So check with the pharmacist before using any over-the-counter medicines or taking any herbal products. This is to make sure that they don't interact with any of the medications that you have been prescribed by your specialist consultant or your GP. Do not share your tablets with anyone else. Make sure you store your tablets in a cool, dry place away from children and pets. And always return unwanted medicines to the chemist. So the next we'll be talking about this is a study, this is a figure that was from a study in 2012. Unused medications cost the NHS 300 million a year in 2012. So it is really important that we don't stockpile medication. Apart from being wasteful, you could end up using out-of-date medication by mistake. So before heading to the pharmacy, look in your medicine cabinet to see what you actually need. You may still have unopened boxes or enough of some tablets. You should inform the pharmacy not to issue them to you. It's also important that you cancel or don't order items that you don't use often, for example, inhalers, creams, GTN sprays, etc. These are known as PRN or as required items. When you need more, you can request it at any time. If the pharmacy continue to supply these, even if you've told them not to, you must report this to the GP surgery. You can also seek help from the service which is called Medicines Management, and we can refer you to them as well, who will be able to also give you further advice. So, medicines management usually accessed by a healthcare professional. The medicines management team work behind the scenes to provide advice and guidance on all aspects of medicines. Team consists of pharmacists and pharmacy technicians. Your GP or other health professional can make referrals to this team if they are concerned someone is not taking their medications correctly or for whatever other reason. They can come out to a person's home and go through all the medications with the patient. They will check the patient understands what and how to take their medications and then will send a report to the GP. They may recommend dose set packs or other aids, especially if the patient has physical difficulty handling their tablets or remembering what and when to take them. This service may be offered in-house by chemists. Ultimately, carers can be organised to come to a person's house if they need help administering their medications, for example, insulin or multiple medications. So, medicines advice. Leaflets can be provided to you, or there are online reputable websites, like we've said already, the NHS Choices. You can ask your pharmacist, especially if buying over the counter preparations. Your specialist team may also provide you with further information. Now we're going to talk about the main medicines you may be on in a little bit more detail. So, anti-platelet medications. So we're going to talk about the first two together. So this is aspirin, clopidogrel, prasugrel, or and as the cardiologist often recommends that you take both aspirin and another antiplatelet for a period of time. This is known as DAPT, dual antiplatelet therapy. So antiplatelets help prevent the blood from clotting too easily. So aspirin is usually lifelong. Others may be set for a certain period of time, for example, 6 months or a year after a stent. So aspirin reduces inflammation in the body and thins the blood. It is usually prescribed lifelong. Low dose 75 milligrams per day. Do not take any other anti-inflammatory drugs at the same time. For example, ibuprofen, diclofenac or naproxen. Some GPs may allow ibuprofen gel for aches and pains though. Aspirin should be soluble. For example, it can be dissolved in water or squashed to reduce the irritation to the stomach. And if you develop stomach pain or irritation, or you've had a stomach ulcer, you may be prescribed a PPI, which is protein pump inhibitor, which is a stomach protector like lansoprazole or omeprazole, along with your aspirin. Clopidogrel or prasugrel is usually taken for 3 to 12 months after a stent, TIA or heart attack, as advised by your specialist. Just take note though, if you are taking clopidogrel, you should be on lansoprazole, not omeprazole, as omeprazole reduces the levels of clopidogrel in the blood. Beta blockers. So for example, bisoprolol, atenolol or metoprolol. So as you notice, these end in LOL, lol. These reduce the risk of heart attack and heart failure by arresting the heart, given following a heart attack or for heart failure. You will have been started on a low dose, which is usually increased gradually up to the maximum tolerated or target dose. This is called up titration. It reduces heart rate and blood pressure, treatment of angina, possible side effects, cold hands and feet, lethargy, erectile dysfunction. It's used with caution with patients who are asthmatic or have COPD, chronic obstructive pulmonary disease, as they can reduce the effectiveness of inhalers and medication. ACE inhibitors. These end in RIL, RIL, ramipril, lisinopril, perindopril or enalapril. ACE stands for angiotensin converting enzyme. The ACE enzyme stops the chemical angiotensin from causing blood vessels to tighten. It's effective at reducing blood pressure and workload on the heart. As we said before, this is also started on a low dose, which is increased gradually up to the maximum tolerated dose. You need blood tests for your kidneys when there's any change to your medication, and this blood test is called U&E. And also it's usually taken before any dose is changed to make sure you've got good kidney function. Usually taken long term for blood pressure, and it's also to reduce the risk of future heart attack. Possible side effects are persistent dry, tickly cough, rash, low blood pressure and reduced kidney function. These medications are only up titrated to what the patient is able to tolerate. If the patient is unable to tolerate an ACE, an ARB, then something else can be prescribed. And this could be an angiotensin II antagonistic, an ARB. So for example, losartan, candesartan, used as an alternative to an ACE inhibitor, as we've already said, if unable to tolerate an ACE due to persistent dry cough or allergy. They work in a similar way, but they do not tend to cause a dry cough as side effects of an ACE do. Possible side effects though for these medications could be fatigue, dizziness, a rash, taste disturbance, low blood pressure, or possible reduced kidney efficiency. So, CCB, calcium channel blockers, for example, amlodipine, nifedipine. This tends to be for high blood pressure or angina, or an alternative to an ACE inhibitor. These types of drugs reduce the amount of calcium entering the heart and the artery cells. These cause the muscles in the heart and the arteries to relax and hence widen, improving the flow and reducing the effort of the heart. The heart cannot beat so powerfully, so less blood is ejected into the arteries, and this reduces the impact on the heart overworking. Possible side effects, though, are ankle swelling and tends not to be used very often in heart failure patients. Works better for those African Caribbean ethnicity over the age of 55, and you can be given both. So statins, for example, atorvastatin, simvastatin, rosuvastatin. So statins are very effective at reducing the harmful cholesterol in the blood, especially LDL, low density lipid cholesterol, which causes the buildup of fatty plaques in the artery walls. Usually taken at night, you need to avoid taking grapefruit juice as this affects the medication. Possible side effects are aching muscles or loose motion. When we say aching muscles, it generally tends to feel like a flu-like symptom. So atorvastatin has replaced simvastatin. So atorvastatin is the most popular medication that is supplied to reduce your cholesterol, and simvastatin tended to have more side effects. You usually prescribe the maximum dose of atorvastatin, which is 80 milligrams, when you initially have a myocardial infarction. If you cannot tolerate it, a lower dose may be considered, and it also may be equally effective at reducing your cholesterol levels. Rosuvastatin can be used for those who are intolerant to simvastatin or atorvastatin, as it metabolizes in a different way. Ezetimibe is recommended as an option by NICE only for the treatment of adults who have familial issues, a family history of cholesterol and heart disease. You tend to have a blood test for liver function. This is done after starting statins or after increasing the dose to check to make sure there's no adverse effects to your liver. And also it's advised that you stop smoking, as it's a known fact that smoking increases your cholesterol. For example, glycerin trinitrate spray or tablets. Tablets are short acting, or you may be prescribed something called isorbide mononitrate, which is longer acting. These are prescribed as an angina reliever and as a precaution after stent insertion. It opens up the blood vessels to increase the blood flow to the heart. If you're on a glycerin trinitrate spray, it tends to work within 5 minutes, and the effects can last up to 30 minutes. If you have got a glyceryl trinitrate spray, a GTN spray, they can come in a variety of bottles. A white one, which is a metal canister, and that works like an aerosol, or it might be a red bottle pump action one, and it tends to be red in colour to try and prevent daylight affecting the medication. If the spray has not been used before, make sure that you spray the spray first to make sure that the medication is coming out. Also check the expiry date on the bottom. You can keep several of these. You could keep one in the car, one in a handbag, one in your coat pocket. So you've always got it to hand if need be. If you need to use your GTN spray or your tablets, make sure that you're sat down initially, and this is because your medication could drop your blood pressure, causing you could also cause you to feel dizzy, or could actually have a side effect of fainting if it drops your blood pressure too much. So you need to sit down, spray your spray, make sure that it's working, then it's 1 to 2 sprays under the tongue, wait 5 minutes. If the chest pain is not being relieved, you can then do another 1 to 2 sprays under the tongue. If the chest pain is not subsiding, after 3 to 5 minutes, another 1 to 2 sprays, and at this point you should be dialing 999 to seek help. Please don't wait if you've still got ongoing chest pains, it's really important that to get an ambulance out to check you over. If the chest pain has subsided by the time the ambulance crew come, they will review you and assess you and advise you if you need to go to hospital or not. If you're on a isorbide mononitrate tablet, the tablets tend to last up to 8 hours as they're slow release and longer acting and can be taken twice a day. Possible side effects could be headache, flushing, nausea, dizziness, or fainting. So if you are having any of these symptoms, it may be a discussion that you need to have with your GP or specialist heart nurse, as a GTN tablets may be more suitable. So, anticoagulants, for example, warfarin and apixaban, used for atrial fibrillation, known as AF, and after mechanical heart valve replacements. This prevents the blood clotting in the heart, which can travel to the brain and cause a stroke. Warfarin requires regular blood tests, and this is called an INR, which is abbreviated, and the abbreviation stands for International Normalized Ratio. So target INR is usually 2 to 3. The higher the INR, the longer it takes for the blood to clot. The lower the INR, the more risk of a blood clot. You could also be prescribed these medications if you've had a DVT or you've got a PE. It's advised not to drink cranberry juice whilst you're on warfarin, or any foods that are high in vitamin K. And also not to drink alcohol to excess whilst on warfarin either, as it can affect the clotting of the blood. Possible side effects are bruising and prolonged bleeding. So if you notice that if you cut yourself, possibly when shaving, you may notice that it takes longer for the bleeding to stop. So you need to apply pressure for much longer. If you find that the blood bleeding isn't, stopping, then you may need to seek medical help. And it may be important to get your INR checked and your clotting factors checked again. These medications have to be stopped before surgery, and they're also used with caution for those that are at risk of or have a history of falls. So, stomach protectors. These are known as PPIs, protein pump inhibitors, for example, lansoprazole or omeprazole. So, this protects the stomach from irritation and ulcers, and used with multiple medications or if you're taking aspirin. So they're more effective when you take on an empty stomach at least 30 to 60 minutes before other tablets and food, and this is to line the stomach. Dose can be increased and taken twice a day for better effectiveness if needed. So what PPIs do is they inhibit gastric and acid secretion, which can cause stomach ache, acid reflux, bloating, and even stomach ulcers. So the incidence of stomach ulcers has decreased significantly since these drugs have been available. Aspirin and other non-steroidal anti-inflammatory medications, for example naproxen, ibuprofen, and diclofenac, are known to irritate the stomach. These are generally not advised for heart patients because of taking daily aspirin already. And these medications are more effective than ranitidine and over-the-counter remedies, for example Renes. So some of you may be prescribed a diuretic, or known as a water tablet. These are used to reduce the amount of excess fluid in the body, known as edema, which can cause breathlessness, swollen ankles, and or raised blood pressure. Most common medications are furosemide or bumetanide, but there are other known ones as well. For example, benzofluozide, spironolactone. Possible side effects are the increased urine output. This tends to be in a short window of time post taking your medication. Some people may experience dizziness when standing up or have a side effects of a headache. It can also worsen gout and muscle cramps. So it's really important that if you experience any of these, that you talk this through with your heart nurse or your GP or consultant. You will need a blood test to check your kidney function, UNEs, when starting or changing any of the dose of this medication. And if you need to report any unexplained change in your weight to your GP also. So we know that diuretics encourage the body to rid itself of excess water and salt, and this is excreted through the kidneys, and that's why you pass more urine during that short window of time that the medications work. This can help to reduce blood pressure by reducing the volume of blood in the body. It's also advisable not to take too much salt in the diet, as this counteracts the effects of the diuretic. But another side effect can be that it can increase blood glucose level, so monitor closely and let your GP know if it changes. So we're not going to go into these medications. I'm just going to let you know what they are. But if you need to discuss this further, then obviously speak to your heart nurse or your GP. So there are medicines to control palpitations. So Amiodarone Digoxin. This controls the rhythm of your heart, and there could be side effects. For example, photosensitivity. So you need to protect your skin from the sun. You may experience a metallic taste, or there may be some visual disturbances. So Vabradine lowers heart rate, doesn't affect blood pressure, and can be given alongside beta blockers. Side effects: low heart rate, visual disturbance. Potassium channel activators, Nicorandil, used if angina is not controlled on any other medication. Side effects: headaches, flushing, low. Alpha blockers, doxycycline, lowers blood pressure. Side effects: low blood pressure, dizziness, leak in urine. So if you've got any questions about your medication, or if you feel that you may need to, some more support and help, your GP or ourselves could refer you to the medicines management team or liaise with your pharmacist to discuss things further. But please get in touch if you need any further support with regards to your medication. Thank you.